40 and single here. I've been grinding for a decade, stashed away $500,000 to live off the interest. I skip buying cars and houses, don't really make friends, and keep clear of social dramas. Financially independent and free. No one's got a hold on me. Small health issues I deal with. Big ones, well, I'm ready to face the end.
Amidst China's economic downturn and severe unemployment, an increasing number of Chinese people are falling into poverty. Meanwhile, the cost of medical insurance in China continues to soar, with a low reimbursement rate leading many to opt out of the healthcare system. Some even prefer to spend their money on high-quality food to maintain health rather than on medical insurance costs.
Rural residents question why there has been a widespread withdrawal from medical insurance in recent years. Firstly, the cost issue. Fees have risen from 10 yuan to 380 yuan. Secondly, as far as I know, the new Rural Cooperative Medical Scheme only offers reimbursements for hospitalization. Common illnesses like colds or chronic conditions that require daily medication, particularly for the elderly, do not qualify for coverage. How often does a person need hospitalization in their lifetime? Especially for rural people who rely on self-diagnosis for major illnesses and self-medication for minor ones, often using painkillers for any discomfort. Is this cooperative medical scheme useful to them if they can't afford or dare not seek hospital treatment for fear of uncovering more health issues? There are numerous issues with the NRCMS, leading to low enthusiasm among rural populations to pay for medical insurance, with some even discontinuing their participation. The cost of NRCMS has skyrocketed from just 10 yuan in 2006 to 380 yuan in 2023, posing a significant burden for low-income rural elderly. The NRCMS has many shortcomings in healthcare provision, with a limited scope of reimbursements. Firstly, it only covers a proportion of the cost of some medications, with other expenses like surgery, diagnostic tests, and anesthesia fees not reimbursed. Secondly, treating diseases cheaply becomes costlier under NRCMS. Without insurance, general illnesses are treated simplistically. But to claim insurance, hospitalization demands various tests, without which reimbursement is not possible. Furthermore, if a patient is hospitalized under insurance, doctors tend to prescribe expensive medications and arrange the best services, leading to higher overall medical costs compared to non-insured treatment.
As rural medical insurance costs continue to rise, farmers struggle to afford the 380 yuan fee, prompting village officials to go door-to-door urging payment. A video posted online shows a female village official in rural China using a loudspeaker to remind residents to pay for their medical insurance, followed closely by a male village official.
Recently, community centers and kindergartens have started to uniformly publicize the medical insurance payment process, making great efforts to ensure everyone enjoys national benefits. Some communities have even introduced incentives like offering eggs for paying medical insurance, reminiscent of tactics commonly used by health product companies in the past.
According to various media reports, a withdrawal away from China's healthcare insurance system has emerged in recent years, driven by the poverty of a large portion of the Chinese population and the ever-increasing cost of medical insurance. In 2022, the number of people in mainland China who withdrew from social medical insurance reached 25.17 million. Data released by the National Healthcare Security Administration of China shows that at the end of 2022, the total number of people enrolled in basic medical insurance in China was 1.35 billion, 17 million less than in 2021. This decrease includes a rise of 8.12 million in employee medical insurance, but a drop of 25.17 million in resident medical insurance. Analysts believe that the mass withdrawal from medical insurance is mainly due to two reasons: the rising cost of medical insurance and the low reimbursement rate. The new Rural Cooperative Medical Scheme, or NRCMS, is an annual medical insurance that Chinese farmers subscribe to. According to a notice published on the official website of the Central Government of the Communist Party of China, the individual contribution for 2023 has reached 380 yuan per person per year, up from 350 yuan in 2022, marking a 30 yuan increase. In 2003, when NRCMS was established, the individual contribution was only 10 yuan. Since then, it has incrementally increased: 120 yuan in 2015, 220 yuan in 2018, 350 yuan in 2022, and 380 yuan in 2023. Over 20 years from 2003 to 2023, the individual premium has increased 37-fold, with an average annual increase of 19.78%. Following this trend, the resident medical insurance fee is likely to exceed 400 yuan in 2024. Considering a family of 5, based on a 2023 minimum individual contribution standard, the annual cost of resident medical insurance would be 1,900 yuan. For the average farmer, this is a significant amount. Many people believe the reimbursement ratio of medical insurance is unreasonable. There are restrictions in many places, only covering part of the medical expenses or not reimbursing certain diseases or treatments. Moreover, rural insured individuals face high out-of-pocket expenses, sometimes as high as 50 to 70%, when seeking treatment in urban hospitals, which have better trained staff and more advanced equipment for serious diseases. Yuan Lixia, a 45-year-old migrant worker from Hunan province, withdrew from basic medical insurance this year. He underwent a 20,000 yuan back surgery in March, but insurance paid less than 40% of the cost. He said, "This insurance does not alleviate my medical expenses. I would rather spend more money on high-quality food to stay healthy." Li Weihao, a 55-year-old former rural construction worker from Hubei province, stopped paying the annual fee of 380 yuan after being unemployed for several months. He told the Financial Times, "I need to make the most of my limited savings, and medical insurance is not my priority." China's medical insurance is divided into employee medical insurance and resident medical insurance. Employee medical insurance is deducted from wages and is mandatory, while resident medical insurance is paid by the residents themselves. Non-payment is considered automatic withdrawal, and they no longer enjoy medical insurance benefits. Wang He, an expert on China issues, said, "For many farmers, the cost of medical insurance is 380 yuan per person. If there are 4 people in a family, that's over 1,000 yuan a year. If the farmer is healthy and the children are in school without any illnesses, they might feel that paying this amount is not worth it. But if there are chronic or long-term illnesses, this cost is a yearly expense. So there are some problems in the design of this system." Independent commentator Zheng Shuguang noted, "The medical insurance sector is heavily eroded by corruption. Retired officials enjoy extensive medical treatment, often spending a lot of money on prolonged hospital stays." The number of people enrolled in China's medical insurance might continue to decline this year, as warned by Chinese officials and analysts. As of the first 9 months of 2023, 8 provinces in China released their insurance enrollment data, with 7 showing a general downward trend compared to the same period last year. Financial blogger and self-media personality Tan Shu Pan Qian commented, "These people are not paying their insurance premiums mainly due to the economic downturn over the past few years, with many low-income groups seeing a continuous decline in income along with rising medical insurance costs." Wang Fanzhou, a 52-year-old single villager from Renhe Township, Xingping County, Henan Province, said he hadn't paid medical insurance for 3 years. 4 years ago, my mother's treatment for a brain hemorrhage in Luohe Hospital cost over 30,000 yuan, and the insurance only reimbursed over 10,000 yuan, and the reimbursement process was very troublesome. Since my mother suffered from high-age intermittent epilepsy, we opted for conservative treatment at home, and she passed away not long after, said Wang Fanzhou. He believes he is physically robust and rarely falls ill, so he decisively stopped paying for medical insurance. "I have experienced both hepatitis B and hepatitis C, but both were cured with a 3-day medication costing 60 yuan at the local clinic. Therefore, discontinuing resident medical insurance doesn't greatly impact me," Wang Fanzhou added. Yang Lishong, a professor at the School of Labor and Human Resources at Renmin University of China, stated that the cost of resident medical insurance is indeed a burden for average rural families. The main issue is that it is difficult for farmers to increase their income while medical insurance costs are rising too rapidly. Hua Ying, an associate researcher at the Institute of Population and Labor Economics, Chinese Academy of Social Sciences, noted in her research that some low-income families report the burden of annually increasing medical insurance payments on their household expenses. Hua Ying explained that villagers choose not to pay for two reasons. First, they see the insurance fee of over 300 yuan as a waste if they don't fall ill. And second, the insurance doesn't cover much in cases of serious illnesses. Some insured individuals feel that it's not worth participating in resident medical insurance, as it barely offers any reimbursements. Wang Xiaoqing, a 28-year-old villager from Daliu Town, Yuanhui District, Luohe City, Henan, underwent an anal fistula surgery at a specialist clinic in his village and spent over 2,000 yuan during his stay of more than 10 days. Wang Xiaoqing said, "I chose to go to that remote rural clinic because of its generations-old reputation and low costs." Before seeking treatment, he consulted at a pathology department in a Luohe hospital, where the treatment required over a month of hospitalization and would have cost about 17,000 to 18,000 yuan, with around 10,000 yuan out of pocket, even after insurance reimbursement. Every year, the cost of medical insurance increases, but the number of medications covered by insurance decreases, Ms. Yang from Beijing mentioned in a media interview. Many drugs have been excluded from the insurance coverage, and patients need to pay out of pocket when visiting hospitals, feeling like they're being trapped by the system. Mr. Zhao from Wuhan said that the number of self-paid drugs increases by dozens each year. He explained, "I used to take furosemide, which costs a few yuan, but now the selling price has risen to 27 yuan, and it's not covered by insurance, equivalent to the price in pharmacies outside, where the purchase price is only about 6 yuan. This is like a scheme to exploit the people." Mr. Zhao stated that although authorities claim a 50% reimbursement rate, many drugs are not covered. "Some of the medications I'm currently taking used to be covered, but now they've quietly been removed from the insurance list. So what's the point of paying for medical insurance? Many drugs aren't reimbursed, and their prices have also increased." Ms. Wang from Wuhan said she and her 2 children do not have medical insurance. She considers medical insurance to be more a facade. "Without insurance, treatment is expensive, and I can't afford it. My 2 children are also not insured. Moreover, many medications aren't reimbursed and have to be paid out of pocket. Nowadays, many unemployed people find medical insurance too expensive. It's just a showpiece, with only the powerful and influential able to receive the treatment they want." Ms. Wang pointed out that local authorities require young people to mandatorily purchase medical insurance. Young people are forced to buy medical and social insurance, or else they face fines. The Chinese Communist Party's medical insurance costs have increased significantly in recent years, far exceeding the slow or even negative growth of Chinese residents' income. Local governments are mired in financial crisis, lacking funds to support insurance plans and shifting the rising medical costs onto ordinary residents. According to data from the National Bureau of Statistics of China, since 2018, the minimum premium for major medical insurance has more than doubled, while the average wage of migrant workers has only increased by 24%. Beijing resident Guo Liben said in an interview with Radio Free Asia on December 12 that many people's incomes have decreased in the last 1 or 2 years. Some people's income has decreased by 20%, 30%, or even 50%, resulting in fewer people insuring. Moreover, with the increase in unemployment, fewer people are opting for medical insurance. In short, the economic outlook is not good. Mr. Song, a retired resident from Jiangsu, said that the mass withdrawal from insurance is mainly related to the decline in personal income. It's mainly caused by unemployment and personal financial problems. Other reasons might be secondary. Honestly, people are feeling a bit panicked. The CCP's medical insurance system has long been criticized. In February this year, retirees in Guangzhou, Wuhan, Dalian, and other places protested against medical insurance reforms that directly cut retirees' medical insurance funds, reducing employee individual account benefits to reallocate funds for the pooled fund. The so-called gray-haired revolution that erupted in Wuhan and other places is generally believed by public opinion to be primarily due to last year's large-scale nucleic acid testing and other pandemic-related expenses, which depleted the medical insurance funds. A video posted by netizens shows that on February 15th this year, during a medical insurance protest in Wuhan, some participants shouted slogans against the reactionary government. The public is outraged that the medical insurance reform only affects the basic medical insurance for employees, while high-ranking CCP officials and officials at all levels remain unaffected. According to information from overseas Twitter sources citing insiders within the CCP system, the Central Healthcare Committee, responsible for no more than 1,000 central and provincial level high officials, received a staggering 16.48 billion yuan in central government funding last year. This contrasts sharply with the 5.16 billion yuan the Hubei Health and Construction Committee received, meaning the medical care expenses for the 1,000 high officials were 3 times the insurance funds of 60 million people in Hubei. On average, this amounts to 16.4 million yuan per official, a startling figure. The officials reportedly spent this health insurance money on luxurious hospital wards and comprehensive health care and treatment costs. A 2005 report by the Chinese Academy of Sciences stated that 80% of the medical expenses invested by the CCP authorities were primarily for the benefit of a group comprising 8.5 million party and government officials. In August 2013, Sina News reported Xinhua News Agency discovered in an investigation into official consumption that a single hospital stay for a retired provincial-level official could cost up to 3 million yuan. Furthermore, once high-ranking officials enter a life support system, the daily cost is over 200,000 yuan, which is not paid out of their pockets but covered by taxes paid by the public. After 3 years of zero COVID policy, China has experienced a severe economic downturn. Guo Song, a primary school teacher who recently moved to New Zealand, remarked that the funds accumulated in China's medical insurance fund over decades were entirely depleted during the 3-year pandemic. The costs of nucleic acid testing and vaccinations were, in fact, borne by the public. A Reuters report on February 15 noted that in 2022, Chinese provinces spent at least 352 billion yuan in response to the COVID-19 pandemic. Guangdong province alone spent over 71.14 billion yuan on vaccinations, nucleic acid testing, and medical personnel subsidies, while Jiangsu province's expenditure was 42.3 billion yuan. These figures represent only a year's provincial spending and do not include central government expenditures. The Chinese government initially stipulated that all patient medical expenses during the pandemic would be covered by social health insurance and public finance. Lin Xiaoshu, a U.S. virologist and political commentator, told Radio Free Asia these generous arrangements turned the CCP's commitment to covering COVID-19 medical expenses into a political tactic, rather than a consideration of actual financial burden. Essentially, the CCP, in showcasing the so-called China model, forcibly implemented the most generous universal health care in COVID-19 treatment. Lin Xiaoshu believes that the CCP's financial policies related to the COVID-19 pandemic are highly opaque, leading to windfall profits for interest groups associated with the government while severely overextending medical insurance. Eventually, when the medical insurance funds were depleted and the state's financial sustainability became untenable, there was a shift towards increasing personal out-of-pocket costs for medical insurance.